A BC union representing thousands of people who work with seniors is calling for the type of protective equipment provided for many frontline healthcare workers to be stepped up. The union wants to see N95 masks used more widely. But as Megan Turcato reports, the health authority says it's not necessary.
Anything that can be done should be done. I don't think we can afford to wait for proof.
A BC union representing thousands of people who work with seniors calling for enhanced PPE.
And what we're hearing from them is a lot of concerns around the personal protective equipment that they're being issued. They tend not to be N95 masks. They're surgical masks.
The union wants employers to provide N95 masks to all frontline healthcare workers.
We need to overreact, and that means using the precautionary principle, assuming that it is transmissible, assuming that it is transmitted through the air, and providing the highest level of protection possible.
A long-term care worker in Vernon who did not want to go on camera, concerned it could impact their job, contacted Global News to say they had not been provided with an N95 mask on request, something they thought should change to protect both staff and residents at COVID-positive facilities.
Certainly where there is an outbreak, the highest levels of protection need to be taken.
Organizations managing private Okanagan seniors facilities with COVID outbreaks, Kygo retirement communities, and the Good Samaritan Society both say they're following provincial directives which say that N95 masks are only required for aerosol-generating procedures on COVID patients, such as intubation.
It's not about the money, it's about the science in general.
The region's chief medical health officer says N95 masks are provided by Interior Health for those select procedures that produce aerosols. But otherwise, the science says regular surgical masks are good enough to protect against COVID.
For the general workers in long-term care, it's not needed because COVID doesn't spread the same way like TB or measles or something else spreads. Most of the spread at this stage that we are seeing is still with a droplet way, so it's like bigger droplets, and if you're within 2 meters of somebody.
The issue of how much protection is enough, clearly creating a divide between some healthcare staff and employers. Megan Turcato, Global News, Vernon.